Good day, viewer. I am Dr. Joachim from Audiete. Today I'll be talking to us about PPH. PPH is simply postpartum hemorrhage. Postpartum, post mean after, then partum mean delivery, then hemorrhage is bleeding. It's one of the leading causes of maternal mortality rate. Women dying after delivery who do not die after giving birth, but it happens when they go to quack. So we at Jomapet Hospital, we are trying to train the TBA, some healthcare provider on the current management of PPH. Now, PPH is simply a significant bleeding after delivery enough to cause symptoms. Vaginal delivery is more than 500 ml of blood. For cesarean section is more than 1,000 ml of blood. Primary postpartum hemorrhage is one that's happened between 24 hours after delivery. The secondary is after 24 hours of delivery. What is the cause of this PPH? The cause is basically, we have 4 basic causes. Usually when the woman delivers after birth, the area of the uterus is to contract. Once it contracts, squeezes those vessels, the blood supply to the uterus. But when the uterus is not contracted, called the uterine atony, it gives room for bleeding. So one of the causes of PPH, postpartum hemorrhage, is uterine atony, uterus failing to contract. Another cause is trauma. When there is ulceration to the cervix and the vagina, a woman can present with bleeding after delivery. Another commonest cause is retained tissue. We call it tissue. It could be retained products, retained placenta, clots that are retained inside the uterus. That's another cause. Then the last one that is not too common is when they have the kind of clotting factor, so they tend to bleed and after delivery. Then how do you manage this condition? That's what Jomapet Hospital is trying to offer TBAs and other health provider on the current management of this PPH. Now, the best management is after delivery, you have to examine the cervix closely, see whether or not there are no laceration, tear. You also need to empty the bladder. If you don't empty the bladder, the uterus will not be able to contract adequately. So you need to pass in a catheter after delivery to give room for the contraction of the uterus. Then you also need to put in oxytocin, some drugs, oxytocin, cytotec to contract the uterus adequately. Then if you notice that if you have done all those stuff, no laceration, uterine is contracting, and then you need to examine closely. You check if there's any retained, you examine the placenta, if there's retained placenta or some clots inside the uterus. If you have done all that, if the woman is still bleeding, it may be bleeding disorders. So we do fresh blood transfusion. So we are encouraging the public, especially the TBAs, those churches, to come to Jomapet Hospital to have this free training so that they won't be having this increased maternal mortality.